Welcome back, everybody, to the deep dive. This time, we're going to take a look at the career of Dr. Insaf Abdul-Halim.
Okay.
She's a family medicine doctor practicing in Abu Dhabi.
Oh, wow.
And we're going to be using a podcast script that really celebrates her work as our main source.
Sounds interesting.
Yeah, and it's going to be interesting to not only learn about all the amazing work she's done,
Right.
but also to kind of dig deep into what makes a great healthcare provider.
You know, it's fascinating because this script gives us a glimpse into how Dr. Abdul-Halim is viewed by her peers and by the healthcare community.
Yeah.
It's like a firsthand account of what makes her such an exceptional physician.
It really is. So one of the things the script highlights is that she has over 10 years of experience practicing family medicine in the UAE. She's currently working at the Mezyad Medical Center, which is conveniently located in the Mezyad Mall in Mohammed bin Zayed City.
Right in the mall.
But honestly, what really caught my attention was just how much she knows. The breadth of her expertise is remarkable.
It really is. It spans across so many areas.
I know.
Chronic disease management, dermatology, obstetrics and gynecology, psychiatry, and of course, general medicine. It really speaks to the depth and significance of family medicine.
Okay, so help me understand this a little bit.
Sure.
We always hear about how important family medicine is.
Right.
But what does continuous and comprehensive care actually look like in practice?
Well, that's a great question. It essentially means being the initial point of contact for a patient's healthcare journey, no matter what their concerns are. Family physicians like Dr. Abdul-Halim are equipped to handle a really wide range of conditions.
Wow.
From, everyday things like a common cold to more serious issues like chronic diseases. And they're also really skilled at coordinating care with specialists. When it's necessary to ensure the patient receives seamless and well-rounded treatment.
That makes sense. Like having someone to guide you through all the complexities of the...
Your healthcare quarterback.
I like that.
And especially when you think about the diverse population in the UAE.
Right.
A family physician who can bridge those cultural gaps and understand those unique needs is incredibly valuable.
Absolutely. It seems like a role that requires more than just medical knowledge.
Oh, for sure.
But also empathy and really good communication skills.
Absolutely.
I'm curious, though, what are some of the biggest challenges and rewards of practicing this kind of comprehensive family medicine?
Well, one of the most significant challenges is definitely staying current with all the advancements in so many different medical specialties.
Right, because it's constantly changing.
Exactly. Medicine is always evolving. And to provide the best care, family physicians need to be lifelong learners.
It makes sense.
Another challenge is just the sheer volume of patients and the time constraints.
Oh, yeah.
It can be really difficult to balance the need for efficiency with the desire to provide personalized care to every single patient.
That sounds incredibly demanding.
It is. It requires a lot of dedication and resilience to manage all of that effectively.
Yeah, I can imagine. But what about the rewards?
Oh, the rewards are amazing. For family physicians. There's nothing more fulfilling than building those long-lasting relationships with patients and their families, seeing them progress through their healthcare journey and playing a role in their well-being overall. It's incredibly rewarding to witness a patient's health improve, knowing you made a difference in their life.
That's beautiful.
It makes it all worthwhile.
I love that. And it seems like Dr. Abdul-Halim really embodies that dedication and compassion. The script is filled with stories about how warm and approachable she is, how she goes the extra mile for patients, and how she can break down really complicated medical concepts. So they're easy to understand.
It's clear that she prioritizes patient-centered care, which is really about understanding each patient's individual needs and concerns, rather than simply treating the symptoms. That approach is really essential for building trust and rapport, which are the foundation of a strong doctor-patient relationship.
And speaking of building trust, I was really interested by how the script mentions that Dr. Abdul-Halim gets her patients involved in making their own treatment plans. Can you talk a little bit more about that?
Absolutely. When patients feel involved in their healthcare decisions, they're more likely to stick with their treatment plans, ask questions, and openly communicate with their doctors.
That makes sense.
This shared decision-making process really empowers patients to take control of their own health and leads to better outcomes for everyone.
It's amazing how such a simple thing and have such a big impact on their whole healthcare experience.
It really shows the power of working together in medicine. And this collaboration goes beyond just individual patient interactions.
Okay.
It encompasses a much broader idea of teamwork within the entire medical facility.
Yeah.
And you're absolutely right. It seems like Dr. Abdul-Haleem really fosters that kind of environment at Mezyad Medical Center.
Yeah.
Our source material highlights how she contributes to this really positive and collaborative atmosphere.
It makes me think about my own experiences, you know. I've definitely noticed the difference between a medical team that works well together and one that's, well, less organized.
Yeah.
So why is teamwork so important in healthcare? What impact does it actually have on patient care?
That's a great observation and a really important question. Think about it like this. A well-coordinated team is like an orchestra.
Okay.
Each member plays a specific part.
Right.
But they're all working in sync to create this beautiful symphony. And in healthcare, that translates to seamless, efficient, and safe patient care.
So it's not just about everyone getting along.
Right.
It's about having a system where information flows well and everyone's on the same page.
Exactly. When doctors, nurses, and other healthcare professionals can communicate openly, share their expertise, and support each other, the patient benefits immensely.
Right.
Difficult cases can be discussed thoroughly. Mistakes can be caught early.
Yeah.
And patients feel reassured knowing that a whole team is looking after them.
This has been such an interesting deep dive.
Yeah.
We've talked about Dr. Abdul-Halim's impressive range of expertise, her patient-centered approach, and her impact on her colleagues. And what really stands out to me is this holistic approach she takes to healthcare.
Definitely.
Both with her patients and with the team she works with.
It's truly impressive, and it reminds me of an experience I had early in my own medical training.
Oh, really?
I was shadowing this brilliant cardiologist.
Yeah.
He was well known for his technical skills.
Okay.
But I noticed he often struggled to connect with his patients.
In what way?
He would explain their conditions in this very detached clinical manner.
Oh.
Which left them feeling confused and anxious.
That must have been quite an observation.
It really was. It made me realize that technical skills aren't enough.
Yeah.
A truly great healthcare provider needs that blend of knowledge, skill, and compassion. They need to see the whole person to understand their fears, hopes, and circumstances.
What a powerful insight.
It brings us back to this question of what makes a healthcare provider truly exceptional.
Yeah.
And, you know, it's not something you can learn from a textbook or a test.
Right.
It's this unique combination of skills and qualities that create a real impact on people's lives.
It sounds like finding that balance between the technical and the human side of things.
Exactly. And I think Dr. Abdul-Haleem represents that balance beautifully. Her commitment to continuous learning keeps her up to date with the latest in medicine.
Yeah.
While her compassionate nature allows her to connect with her patients on a deeper level.
It's a great combination.
It's rare and incredibly valuable.
As we start to wrap up this deep dive, I wanted to get your perspective on something.
Sure.
We talked about the importance of teamwork.
Right.
But what about the patients? How can they contribute to a more collaborative environment?
That's a fantastic question. It's something I wish more patients would think about. You know, healthcare is a two-way street.
Right.
The patient plays a vital role in making sure their care is collaborative and effective.
So it's more than just showing up to appointments and following the doctor's orders.
Exactly. While those things are important, there's so much more you can do.
Like what?
Be prepared to actively participate in your appointments.
Okay.
Come with a list of questions. Be honest about your symptoms and concerns.
Right.
And don't be afraid to ask for clarification if something is unclear.
I think that's really good advice.
Yeah. You know, it's your health.
Yeah.
You have the right to be fully informed and involved in those decisions.
Sometimes I think people can feel a little intimidated.
Oh, absolutely.
Or hesitant to speak up.
I understand that. But it's so important to overcome that hesitation.
Yeah.
Your healthcare team is there to support you, not to judge you.
Right.
And the more open and honest you are, the better they can help you.
What about communication with the rest of the healthcare team?
That's another important area. Keep track of the medications you're taking. Share important information about your medical history.
Okay.
And don't be afraid to advocate for yourself if you feel something is being missed.
Yeah.
If you're seeing multiple specialists, make sure they all know about each other and the different treatments you're receiving.
So communication is key.
Absolutely. And when patients actively participate in that communication, it can really make a difference in their care.
Dr. Insaf Abdul-Halim's career is truly inspiring.
It is.
And as we learn more about her, I'm curious, what qualities do you look for in a healthcare provider? What really resonated with you today?
It's a question we should all think about and maybe even reflect on personally.
I hope this deep dive gets people thinking and talking.
Me too, because healthcare affects all of us.
Yeah.
And knowing what we value in our healthcare providers is so important for our own well-being.
You know, it's easy to focus on the technical side of healthcare, but in the end, it's the human connection that really matters.
It really is. It's about finding a provider who not only has the knowledge and skills, but also shows empathy, respect, and a genuine desire to be a partner in your healthcare.
Dr. Abdul-Halim's story is a great example of that.
Yeah.
It's not just her qualifications or knowledge, it's how she makes her patients feel understood and respected.
Absolutely. That feeling of connection and being cared for can have a huge impact on a patient's well-being.
I want to go back to something you mentioned earlier about family medicine being the foundation of healthcare for so many people.
Yeah.
Dr. Abdul-Halim's work in the UAE really shows that.
It does, and it highlights how important family physicians are in our communities.
Yeah.
They're often the unsung heroes, providing care to individuals and families throughout their lives.
And as we've seen with Dr. Abdul-Halim, they can have a ripple effect, not just on their patients, but on their colleagues and the whole workplace culture.
It's a reminder that excellence in healthcare isn't just about individual brilliance. It's about building a system where collaboration, compassion, and patient-centered care are at the forefront.
Well said. And on that note, we've come to the end of our deep dive into the career of Dr. Insaf Abdul-Halim.
It's been a fascinating discussion.
It has, but the conversation doesn't have to stop here.
Right.
We encourage you to think about these ideas and reflect on what's important to you in your own healthcare.
What qualities do you look for in a provider? How can you be more involved in your own care?
These are great questions to consider as you navigate your own health journey.
And remember, knowledge is power, especially when it comes to your health.
A huge thank you to all the amazing healthcare professionals out there who, like Dr. Abdul-Halim, dedicate their lives to improving the well-being of others.
Your hard work, compassion, and dedication make a world of difference.
Until next time, stay curious, keep learning, and most importantly, take care of yourselves.